Hello, PsychU community. I'm Dr. Jehan Marino, Senior Clinical and Scientific Liaison from the Otsuka Field Medical Affairs team. And today I'm joined here with Mr. Michael Townsend, who is a licensed clinical social worker and the Deputy Chief Executive Officer at Gateway Counseling Center in the Bronx, New York. Today's discussion is part of our interview series dedicated to Mental Health Awareness Month. So thanks very much for being here today, Michael, to share your thoughts and perspective with our PsychU members.
Thank you for inviting me.
So can you tell us, what does May Mental Health Awareness Month mean to you as a clinician?
Okay, as a clinician, I think the importance of it for me is twofold. One would be that it's mental health awareness. It's not mental illness month. And I really like that we're going from the perspective of promoting health, because the mental health affects everyone. Where mental illness specifically could be someone who has an impairment at a given time, but we want to promote as best as possible the optimum functioning. When we think about health, it's not the absence of illness necessarily. Health could be that everything is working the way it's supposed to be at the optimum level. And when we think about promoting mental health and identifying a month throughout the year to really focus on, it would be nice if every day of the year we all focused on it. But sometimes driving the attention towards it, where I'm sure that most people love their mothers throughout the year, but Mother's Day is that seminal moment where we kind of focus on it. So if we're able to take the 1 month of the year to really drive our attentions to it, I think it's really, really helpful for the general population as well as for people in the helping services.
You bring up a really great point. We should be always thinking about our mental health and mothers, not just on that Mother's Day. So really important idea. So what are some key things that you wish the general public was more aware of in regards to mental health?
Well, I guess one of the driving motives or operating principles for me is always trying to diminish or decrease the amount of stigma that people experience. And when we think about mental health, it's really a better way to look at it in regards to promoting, diet and exercise and stress reduction and socialization and all these different things that promote health, both physiologically, psychologically, emotionally. And I really would want the public to also realize, and if anything, I know we're coming out of hopefully the last 2 years of a pandemic, but also kind of recalibrating ourselves to what our priorities are, what's important, what does health mean to us in terms of physical health, but also mental and emotional, where people were separated from families and friends and from work. And to realize we all have that kind of susceptibility to stress and trauma and anxiety, and being able to look at it not as it's someone else's issue or someone else's problem. We're all uniform in this. And that it becomes a kind of central point for everyone to kind of focus on their health, the health of their neighbors, their friends, and their family, emotionally and mentally. And I think it's really, really important.
Yes, the idea of a community and to be looking out for everyone and ensure that we are helping to decrease stigma. Again, another really important point, that we have to be educating everyone around us to be more aware of mental health, and that's a really important part of our overall wellness. So what are some items that you wish that healthcare providers were more aware of in regards to mental health?
Okay, well, as I operate in the field of human services and mental health, obviously, and mental illness, as I look to my brothers and sisters across the aisle in physical health or other kind of health professionals, also to have an understanding regarding that your psychiatric health, your mental health is connected to your physical health. Sometimes it's like, oh, well, psychiatry is there, but oncology is here, gastroenterology is here. Well, it's all part of the same entity, the same person. And when we think about mental health and mental illness specifically, it's part of the brain, the way the brain operates, the way the brain functions. And it's not an intangible, it's actually a real thing that we have to work in collaboration with other professionals. I realize that throughout the scope of PsychU's reach in regards to all across the country and parts of the world, there are other areas that maybe do not have a prominent or preeminent psychiatric treatment. So sometimes it falls upon the primary care physicians to also look at mental health issues, to be open to it, to kind of learning about it. If they're able to coordinate with other psychiatric professionals in their community, great. But if not, understand that it's all part and parcel of the entire person. It's not just a small component, because depression will indicate sleeping patterns and also eating patterns and risk-taking behaviors and these other things, or maybe sometimes people will self-medicate by the use of drugs and alcohol to deal with symptoms that they're having, and trying to have a kind of an understanding of that. I know we all try to stay within our professional discipline, which is greatly appreciated, but also sometimes absorb different ideas and thoughts that would be beneficial to your patients and to your clients on a holistic scale.
Yes, again, another really important point to really be integrating with our primary care providers and making sure that they are aligned and educated around mental health and treating depression, because if they're not taking their antidepressants, they're probably not taking their antihypertensives too. We have to think about the mind-body connection. So that's, again, really important point that you bring up today. So just wanted to thank you again for your time today and sharing your perspectives during this very important month of Mental Health Awareness Month. And this concludes our interview for today.
Thank you very much. And to the PsychU community, happy Mental Health Awareness Month.
Thank you.
You're welcome.